Today I would like to share one of my experience from a patient who taught n number of things to me. This patient presented to the emergency department with history of fever, history of dyspnea, hypotension and history of receiving treatment for the same condition at an outside hospital and was referred to our higher center for further management. So we decided to rush this patient to our ICU and start a treatment protocol for him. These are the cases which we routinely manage in our center, and then n number of questions arise to our mind ki what we are dealing with it and what antibiotic should we start for them. Now this in the era of antibiotic resistance which day to day we are facing, we have come across few of these cases who have been receiving treatment at outside hospitals, who had been given multiple antibiotics and still they are not responding to any antibiotics. So the global rise of antibiotic resistance, what we are seeing in day to day life, need to be tackled at an early stage and in a wise way. So we decided to go in a different way for our patient, and initially we started him with multi-drug resistant organism which might be we are dealing in this patient by sending him blood culture, and simultaneously we also decided to send him respiratory profile or an other like septic profile in this kind of patient. So initially we started him on broad spectrum antibiotics. Now routinely what the challenge we face is that even though the markers indicate to us that this person is being dealt with as a sepsis case, but still initial 48 hours they fail to respond to our broad spectrum antibiotics. In our case, we had sent this Respiquick panel, which is a multi-drug resistant indicator for us and also for guiding our patients. So with these kinds of scenarios of the patient, I would like to highlight few of the things. One, as we know that there is a global rise in the cases of multi-drug resistant cases. Second, as we know there is a rampant use of antibiotics where this antibiotic resistance is increasing. Third, we know that there is the prescription being carried out by different number of doctors without understanding the basics of completing the treatment course. And finally, we should be dealing with a severe sepsis case which requires to be tackled in a efficient way and timely way. So what we require in day-to-day practice is that the test should be reliable, the test should give a quick result, and the efficacy of that test should be better, so that whatever antibiotics we are using for our patients should target on that organism and give us the result as early as possible, so that the septic mortality what we are seeing in day-to-day life should be brought down and targeted therapy should be given. So as we know that there are superbugs which are going with us, Klebsiella, then methicillin resistant Staph aureus, Enterococci and vancomycin resistant cases. All these superbugs need to be tackled at an early stage. With this Septic test, what we are getting advantage is that we get the result just the next day. We get the resistance pattern in them so as to choose a proper antibiotic for it, and finally we can target our infection to get the better results with the lesser chances of using multi-drugs and increasing the resistance overall. So this helps us in guiding the clinical scenario and also to get the results efficiently.
Thanks for watching Quick Bits.